Okay, so do the femoral nerve block. Obviously, your anatomical landmark will be, it needs to be in the inguinal crease. So position of the patient, laying flat. Okay, you're going to inspect the inguinal crease. Yeah, then you're going to sort of, in terms of palpation, you'll know that's your ASIS, that's your pubis. So it's going to be your inguinal region with the inguinal ligaments. Yeah, and then you put your probe and you try to find your femoral artery. Okay, and in this view, you see the femoral artery nicely. Okay, and you see the nerve is usually very flat triangular structure. Okay, now in this case you can really see nicely the fascias. Okay, so you've got your fascia lata, okay, and your fascia iliaca. Okay, you can see nice. Now, how to recognize fascia? Fascias are white, black, white. Yeah, fascia aponeurosis, they're all like white, black, white. So you can see white, black, white. Yeah. So if I start to scan more, and this is your iliacus muscle, okay? If I increase the depth, then I see another muscle there. That's your iliopsoas tendon. So psoas muscle, along with the iliacus, goes and inserts on the hip joint, okay? So it's your iliopsoas tendon, yeah? Okay, so that's your iliacus muscle. That's your femoral artery. This triangular area is your area of interest. So if I go up, then I can start to see probably things a bit more better. As you could see, more nervous looking structure, your nervy looking structure here. And so this might be a good area to go because you can see the nerve. Can you see it? Nerve fascicles?
Yeah.
So it's not always lateral. You may have a nerve, you may have a nerve sitting on the top of the artery, okay? It all depends on your position of the ultrasound probe. So the positions which are described by anatomy landmark is usually lateral, and then you put the needle in and you try to look for the quadriceps dancing, patellar dancing. But in this case, it may be anywhere, but your area of interest is this. Anything that looks like a nerve, you pierce the fascia and put the local anesthetic in that area. And that
This is
should
not
do.
a lateral.
No, it's not a lateral. Yeah, it's not a lateral. So it
you
can be different.
Turn the probe the
Like that.
opposite way.
Yeah, and then come in. That's your fascia lata, fascia iliaca. Go in, inject in that area.
Okay.
Yeah, because that's where I can see the nerve much better. If I do that, look at that, it's gone. It's gone, completely gone. So you just see femoral artery. So you go up where you start to see the nerve better.
So you just went up?
Yeah, just it, went up and then just turned oblique. So that's the beauty of the ultrasound. Your point of optimal visualization may not be your point of optimal blockage. So
what sort of play is it? Is it just do you keep the probe slightly angled? Or?
angled.
Okay.
Angulation of the